Welcome back to the podcast. Really excited about today's episode. I've got Ashok Gupta here. We're going to talk about brain retraining strategies for chronic pain, for anxiety, chronic fatigue. This is really powerful information. And Ashok Gupta is an internationally renowned speaker, filmmaker, and health practitioner who's dedicated his life to supporting people through chronic illness and to achieving their potential. He's published several medical papers, including one that he just sent over to me. It's out of the Journal of Clinical Medicine. It's mindfulness-based program plus amygdala and insula retraining for the treatment of women with fibromyalgia. And so I know that's a lot of high-level words right there, talking about different parts of the brain, but we're going to go into that in this podcast and really make it applicable for you, the listener. And if you know people that are suffering with anxiety, with chronic pain, with fibromyalgia, this is definitely a great podcast to share with them. It's going to be really empowering for them and give them strategies they can start to take action with to really take back control of their health. Let's see, Dr. Gupta, he developed the world-renowned Gupta program, which launched in 2007, and he has helped many recover their lives from complex chronic illness. He also developed an app called the Meaning of Life Experiment that is 4.7 star rated app, really powerful stuff with videos and meditations. And then in 2020, he created and hosted the free 10-day coronavirus challenge, which is helping thousands of others taking the pledge to reduce the spread of the virus through boosting the immune system, reducing anxiety, and saving lives. So, Ashok, welcome to the podcast.
Hi there, David. Lovely to see you, and thank you for inviting me.
Yes, absolutely. Well, I know that you struggled, and really, just kind of like me and so many other people in the field, you have a pain to purpose story where you struggled with chronic fatigue. And then you developed systems that helped you overcome that. And now you're out helping so many other people. So let's talk about your story.
Yes, and I guess many of us who are involved in this area have been on a similar journey, because it's only once we've experienced it ourselves that we can truly empathize with people. So my journey is many years ago, 25 years ago, when I was studying at Cambridge University doing my undergrad, I developed some kind of strange illness as a result of going to India, in fact. So I'd gone to India for, a holiday. And as a result of that, I came back and then just had excruciating symptoms. Yeah, this was in my second year of university. Yeah. And from then on, those symptoms never abated. They just continued. And as you can imagine, suddenly it's a brick wall in front of you. Yeah, no matter what happens, you just don't have the energy, you don't have the health. And I thought my life was over, because doctors would say, there's nothing you can do about this. That's it. And I would go from practitioner to practitioner trying to understand. And that really was my journey, my start to understand, well, what causes these conditions and how can I support people through it?
For sure. And what did you find out? So you went to India, a lot of people when they're traveling get parasites or they get some sort of infection that drives inflammation. And obviously that inflammation can impact the brain. Mm-hmm. Did you find out what kind of the root cause was?
No. So I went through all the investigations as to what might be causing this condition. But really what they found was that the bug itself went, but I still had the ongoing symptoms.
So almost like a post-traumatic stress from the actual infection.
Yes, absolutely. And that's similar to the way that we describe these types of conditions. It's a learnt response, a traumatic response, but not in a psychological sense, but actually in a physiological sense. And that's what it felt like. So from then on, that started my journey to say, right, I want to discover what causes these conditions. And I then researched a lot of the brain neurology of stress, the brain neurology of emotion and illness, and put that together with a lot of physiology that I was studying off my own back at the time. And then wrote a medical paper, which was published online in 1999. And then we published it in the Journal of the Medical Hypotheses Journal in 2002. So yeah, that was really my journey from being sick to then writing a paper about it and then healing myself. So during the writing of that paper, I understood what was going on. I was experimenting with my own brain and then was able to retrain it and get back to full health. And I've been healthy ever since.
And that was the Gupta program that, you later created. And that's basically what you use. You were testing it on yourself. Mm-hmm. And in that program, you talk about limbic retraining and specifically the amygdala and the insula, two key parts of the brain. Mm-hmm. Tell us what those structures do. Like what's the function of those?
Right. So amygdala, there's two of them that sit behind our eyes.
Mhm.
And their role is to take in incoming sensory data, process it according to what is dangerous or what is life-threatening, and create the emotional context. So emotions are essentially survival instincts, like fight or flight.
Mhm.
So it creates the emotional context of what we're experiencing, and then creates the emotional response and the physiological response and the immune response, um, to protect
Right.
and save us, essentially, and communicates with the rest of the brain in terms of what memory is traumatic or what experiences might be traumatic, and warn the brain about that. So if we're about to put our hand onto a hot plate, but we feel
Mhm.
fear, that feeling of fear is don't put your hand on the hot plate. So that's how the amygdala works. And then the insula is a brain structure that strictly isn't in the limbic system, but sits in the cortex, between the limbic system and the cortex. And the insula's job is to take in incoming sensory data from the body specifically, not only the external environment, the body specifically, interpret it, and then create the appropriate response which maintains homeostasis. So it's almost like the master controller of the immune system, the nervous system,
Mm.
etc., that often isn't talked about, but it plays a very crucial role, and pain perception and pain modulation as well. Same with the amygdala. So both structures have similar roles, with the amygdala very much focusing on emotional context and the outside world and the inner world, but the insula specifically about the inner world.
Yeah, really fascinating. And basically those systems are all designed to help keep us alive and to survive. They're all built
Mhm.
for survival. And for some people, if they've been through a lot of trauma, they can kind of be hypersensitive, right? And
Mhm.
that's kind of what you're looking at when the limbic system is just overwhelmed, right? Is that correct?
Yes. So if I can just describe how these illnesses work, and that will give us a
Yeah.
good context to describe the answer to your question. So imagine when we are stressed, when we're anxious, or under a lot of pressure, let's say, and this even happens as, let's say, marathon runners, for instance.
Hmm.
We've got a lot of physical, emotional, and mental stress in whatever capacity that might be. And it's combined with some kind of physical trigger. So that physical trigger could be mold exposure, it could be a bacterial infection, a virus like COVID-19,
Hmm.
or any other kind of trigger to the body. Combination of those two things, as well as a genetic vulnerability to that kind of illness, then may trigger an altered response in the brain. Because if we ask the biggest question of all, why are we here? Right?
Yeah.
Now, if we ask that question from a philosophical perspective, then obviously that we could talk about that for hours. But from a scientific perspective, we're here because over millions of years of evolution, this nervous system, this immune system, has adapted and survived and made sure that we now are tuned to peak perfection to deal with the environment. Okay. And so suddenly, when we've got a flu, let's say, and we're very stressed, our immune system's effectiveness is lowered. And so there's a survival threat there. Because as we now know, and it's become, really in the mind's imagination, flu does kill many people, many thousands of people every year. And so the brain makes a perfectly logical decision, which is we need to over defend against this flu virus. Just like with COVID-19, the immune system goes into overdrive and overinflames the body as a last ditch
Yeah.
emergency response. So we know there's evidence of this. But by doing so, it then gets stuck in that state. It's like you
Mm.
press the switch, but the switch doesn't pop back out again. And from that moment onwards, even once the original sensitizing event has gone, so the mold exposure is no longer there, the virus is no longer there, the Lyme disease is no longer, the core bacteria isn't necessarily there in large proportions. It's left a legacy in the brain, which the brain says, right, anything that reminds me of the original sensitizing event must mean we're still in that danger response and that danger experience.
Mm.
I must over trigger the immune system and the nervous system according to that genetic vulnerability, physiological experience at the beginning of the condition, and any other vulnerabilities that person has. So that's the legacy. That's the conditioned response in the brain. And a crucial word that I want to share with people, two words I want to share with people, is
Yeah.
differential activation. So in neurology, it's a beautiful term, which essentially means if before 10 units of mold or 10 units of, let's say, some bacteria would trigger 100 units of immune response,
Hmm.
now 1 unit of
Mm.
that initial sensitizing substance can now still trigger 100% response in the body. And that explains to me so many different conditions. And when they've done this analysis in animal studies, it's generally the amygdala, the insula, prefrontal cortex, anterior cingulate, the same brain structures come up again and again as the root cause.
Yeah, really interesting. So people are basically closer to threshold, and like with fibromyalgia, for example, one of the big mechanisms there is a hypersensitivity. So what may for most people they wouldn't a certain stimulus wouldn't cause pain or wouldn't cause discomfort. That same stimulus can cause intense discomfort for the person with fibromyalgia.
Exactly. And there's a beautiful mechanism that we've described in many of our medical papers, which is this idea of the stress signature, especially in fibromyalgia. And let me describe that. So let's say somebody has a car accident, or they have a localized pain in their part of the body, which is there. Now, according to our process that I've described, that localized pain syndrome can generalize to the entire body. And so the signaling is coming up to the brain through the peripheral nerves and becomes magnified in the periaqueductal gray, the thalamus, all of these brain structures magnify the signaling because the brain is hypervigilant. Those signals come up to the amygdala and the insula. And the amygdala and insula think, right, we may well be in danger here, much more than the original situation. Let's overstimulate the immune system and nervous system and direct inflammation to where the pain is. So there's a direct, and that's the brain thing, that's the brain's logical decision. I must inflame the areas where there's potential infection sites. So it inflames that part of the body. Now, let's say that's your arm. That then sends signals back to the brain saying we're still in danger. And you can see that vicious loop where the brain and the body are constantly responding to each other. So now whatever was the original source of that pain is irrelevant, because the body itself is creating the very response which it is responding to, which is why people can have these illnesses for years, decades, because it's a closed loop. There's nothing external that's necessarily required. And on top of that, we get inflammation in the brain. So the brain is a generalizing machine. So if it feels there's something sensitive like a perfume, it may then also find that the smell of gas will also be something it's sensitive to. So you find people with chemical sensitivities then generate multiple chemical sensitivities or multiple mold sensitivities and light and sound sensitivities, because the brain has got into that hypersensitive response and generalizes. So now something that started off as a pain in your arm can now become fibromyalgia in all parts of your body. Something that started off as a flu virus can now start creating intense symptoms throughout your body. And that's how I believe a lot of these conditions start.
Yeah, I mean, it makes a lot of sense. So the brain is no longer adapting to the proper environment. It's just locked into a survival mode. And inflammation, we know, helps basically protect against systemic bacterial infections. Bacterial infections have killed more people throughout the history of mankind than anything else, from meningitis, pneumonia, things like that. So it's adapting, thinking that, okay, I'm at risk for some sort of infection coming in. So I've got to create this inflammatory storm, but we're really not at risk. Our body shouldn't be creating that sort of response. And so you mentioned several different symptoms like chemical sensitivities. We've talked a little bit about fibromyalgia. What are some other symptoms that are associated with like a limbic system injury?
I put all of these conditions under the banner of neuroimmune conditioned syndromes, which I believe describes ultimately the underlying cause and the reason so many people have different symptoms. And no two patients are the same. We'll often find that in the clinical environment, because once the conditioning has occurred, it's unique to that individual. So we may separate this as chemical sensitivities, but what happens if someone's got chronic fatigue and chemical sensitivities? Which way around is it? Which is the dominant injury, as it were? So along this spectrum, we can have more of the sensitivity syndromes, which are related to chemicals and food. So we also treat food sensitivities. And the other end of the spectrum can be things more related to pain, and which is more internally or pretty much fully internally generated. And along that spectrum, there can be multiple signaling. So we can have pain and chronic pain syndromes at one end. Then we can have chronic fatigue syndrome, which if people haven't experienced ME or chronic fatigue, it's like your worst day of flu times 10 is the way to describe it. So immune symptoms, so your glands getting swollen, sore throats, you can feel physically, mentally, emotionally exhausted, cognitive issues, memory challenges, difficulty thinking. I mean, I remember when I was ill, I tried to open up a textbook and my eyes would be scanning the words, but I literally could not focus on what the meaning was. So just a brain fog.
Yeah.
And then with chemical sensitivities, you're getting those allergic type responses to even small elements of those fragrances. Same with mold as well. So yeah, generally you've got sensitivity reactions, you've got intense fatigue, and then pain. And there's many other symptoms, obviously, that people experience.
Right.
Muscle aches and muscle pain is a real difficult one for people because it just doesn't seem to have an explanation. But when you really interview patients, they realize that they're tensed up, that they're holding their bodies in a state of tone, ready to react. And if anyone's ever tried this, if you hold your leg up for a few minutes, you'll get a buildup of lactic acid and a buildup of pain, which is precisely in a minimal form what people with fibromyalgia are experiencing.
Yeah, that makes sense. And I would go further and say really almost any health condition where you have tried to make lifestyle changes. You've tried a lot of the healthy nutrition approaches, exercise, improved your sleep, you've taken some key supplements, addressed some different nutritional deficiencies, and yet you just seem to hit a plateau. You're just not getting results. And if you're stuck and locked in that, you really got to start to look at that limbic system. And it's kind of like what you were saying. A lot of times when people think about limbic system, they think about it as some sort of major emotional event, like possibly being abused as a child or having a divorce or bankruptcy, some sort of major emotional trauma. But what's interesting about what you're saying is it may have been a physical trauma or a chemical trauma or like a micro trauma, like, for example, getting a parasite infection, something along those lines that left a scar inside the system. And then now that's actually playing itself out with this sort of limbic injury.
Yes, and you've picked up on something really important, which is it is modern medicine that makes this artificial differentiation between the emotions and the physiology. As far as the brain's concerned, what do I need to do to survive and protect myself? And that will involve mental, physical, emotional responses in a coordinated response, which is why when we have flu, we feel tired, we feel exhausted, demotivated, to force us to rest and allow the immune system to fight. So in this, the reason that the modern medical profession finds it difficult to treat these illnesses is because of that separation. We have a separate immunology department, a separate physiology department, separate psychology department. But this is a defense from the brain. It's a software system which is doing exactly and perfectly what it thinks is the right thing to do and now needs updating. And so that software response, as it were, is does not differentiate between emotions and physiology. And mainstream medicine is really about treating the hardware. So it's very good at treating the hardware, treating the body like a car in a very reductionist capacity and saying, right, something wrong with the engine, let's fix that. But what happens if there's something wrong with the electrical system? Right. And I just want to obviously let people know that I am being interviewed right now in a car, which is the ironic. I thought I'd bring in this analogy that the car, actually, modern cars, the things that tend to go wrong with it are the electrical systems because they're so complex. And so actually it looks like something's wrong with the engine, but it's the electrical system which is sending the wrong signals or short circuiting, or there's a water leak and it short circuits. So that is the analogy to take, that the medicine is good at treating the physical hardware, but now we need the electrical engineer to come in and treat the electrical system within the car. And that's what we're fixing with brain retraining.
Yeah, that makes so much sense. So let's talk about where you get started. So you've created the Gupta program to retrain the brain, to help retrain the limbic system. So how do you go about doing that? Like, where does somebody start with that?
Right. So I think the first thing is recognizing that there is a way forward. So I know so many people feel so negative and like, there's no way I can get better from this. And they join these support groups who tell them there's no cure, especially in the field of ME/CFS. And the first starting point is to know that many people have got better from these conditions. There is a way through, there is hope, because that's the first starting point of any major change that we want to make, and an acceptance of where we are. So that's the first port of call, is feeling a sense of acceptance. Then I think the next step is what we do in brain retraining is we encourage a patient to do three things, the 3 R's of the Gupta program. So firstly, retraining the brain. And that involves recognizing the signaling. because this signaling is unconscious. It's not in the mind. It's not a person's fault. It's completely unconscious. So I want to dispel any myths that we're saying it's in the mind or it's psychological. These are real physical illnesses with injuries in the unconscious brain. No one's to blame for this. But once we recognize that, now we can actually use some of the mechanisms within the prefrontal cortex and the anterior cingulate and all these brain structures, which are a conscious awareness. We can start using those structures to retrain the unconscious structures. So we teach a patient to recognize the unconscious signaling and then do a specific 7-step process that we spent 20 years designing to really be able to retrain those responses into safety responses. And in some of the neurological research, this involves safety neurons being projected from the front of the brain, our conscious rational mind, down to the amygdala, down to the insula, down to limbic structures to instruct the brain that the world has changed. We are no longer in those specific dangers. But these aren't cognitive behavioral processes. They're not anything like that. These are, can we only describe them as brain retraining? So that's the first R of the Gupta program. The second R is relaxing the nervous system. Because if somebody is very anxious or there's a lot of activity in the brain is less rewirable. And we know that from some research. But actually, we use lots of different relaxation techniques, meditative techniques, even if someone's very anxious, to calm the brain overall so it becomes more malleable and pliable and rewirable. It's a very, very important aspect of it. And also, as you've mentioned, the lifestyle of healthy diet, sleep, anti-inflammatories, all those kinds of things that we know support people's general health. And the third one, which is often missing, is re-engaging with joy. That actually, if we're depressed, if we're anxious, if we feel our life isn't going anywhere, then actually that blocks some of the rewiring. So we encourage people to, and we give lots of techniques, how to re-engage with the things that really matter to us, to discover what matters to us, to engage with those joyful moments. And it reminds me of the film Patch Adams and that very famous doctor who used humor and laughter to heal so many people. And it's a very important part of retraining the limbic system. So we call these the 3 R's, and it's like a dove flying. So a dove needs 2 wings to fly. So you need that retraining and the relaxation, and it needs tail feathers to have a direction. That's the re-engaging the joy. So it's that overall package that we find gets people back to health.
Yeah, absolutely. And you use breathing techniques as well as meditations with that. And how does that work is that all part of the calming the brain?
Yes. So we know exactly. So we know that every time we have an emotion or a reaction, it changes the pattern of breathing, the rhythm of breathing. And this has been known in the ancient times for thousands of years. If we then change the pattern of breathing, it has a feedback loop to our emotional brain, specifically back to the amygdala and other parts of the brain as well. And through breathing techniques, we can calm it overall and then slip into a deeper state of calm and meditation afterwards. So breathing is always a precursor to that deeper relaxation. Yeah. And that enables people to also, and it's also part of our brain retraining. So when people are using the 7-step process to retrain, breathing is an intimate part of that, as well as smiling. Because we know that when we put on an artificial smile, it impacts on so many levers within the brain and the body.
Yeah. Powerful stuff for sure. Let's talk about this study that you guys recently got published out of the Journal of Clinical Medicine. And the title of it is Mindfulness-Based Program plus Amygdala and Insula Retraining. So the stuff that you've been talking about as we've gone on in this interview for the treatment of women with fibromyalgia. And it was a pilot randomized control trial. Now, randomized control trial is, obviously it's the gold standard when you're trying to compare some sort of a therapy. And so let's talk about the results that you guys saw with this.
Well, we're very excited to have. We've spent literally 10 years working on this. Pushing to get trials in this area, experimental area, is very tough. So this is, as far as we know, the first randomized controlled trial ever published on a limbic retraining or brain retraining type program. So we took 2 groups of people, all with a diagnosis of fibromyalgia, and one had relaxation techniques. So that was the control group. And then another group had the equivalent time with the Gupta program. And so obviously it was a good control because we could see, what is actually the effect of relaxation techniques per se and an equivalent amount of practitioner time. And this was simply an 8-week intervention. So we encourage our patients with the Gupta program to follow it for at least 3 to 6 months as a minimum. to really get good results. But this was just an 8-week intervention. And just with that 8 weeks, we found a 37% reduction in fibromyalgia scores in the active Gupta program group, but 0% in the control group, which is the major headline. 50% increase in perceived health in the Gupta program group, but only 16% in the control group. Close to a 50% reduction in anxiety and depression with the Gupta program, and close to a 50% reduction in pain catastrophizing. And once again, very small effects in the control group. And then we also measured inflammatory markers. The inflammatory markers were lower in the active Gupta program group, but not necessarily significantly, statistically significant. But we did have a good result with BDNF. Now, BDNF is brain-derived neurotrophic factor, which is often increased in fibromyalgia. And actually, the Gupta program managed to reduce that and normalize it towards healthy controls, which was also a great result in terms of having something objective to measure as well. So yeah, this kind of result just after 8-week intervention, we do believe if this was then followed with patients having a 6-month intervention, we would get even better results. And in any case, this was a great result anyway. So we're really excited by this, and we're pushing for larger scale phase 3 trials to really prove the power of this to the mainstream medical profession.
Yeah, really interesting. I mean, it's a pilot study, so it was just a study to see, hey, should we go further with this? But obviously, those results speak for themselves. I don't think there's any other therapy out there that's getting that kind of results with fibromyalgia patients. In fact, fibromyalgia patients are often really just kind of discarded by the medical field, and they're kind of lumped into a box. And most of them really are not given hope. And so to see results like that's really, really promising. And you talked about BDNF. So typically, I've learned that BDNF, is a neurotropic growth factor and really important for helping prevent against things like dementia and Alzheimer's, and activating BDNF through exercise, through intermittent fasting, through good sleep habits, through omega-3 fatty acids, things like that is actually a really positive thing for our health. Now, what's interesting is you said that BDNF levels tend to be higher with fibromyalgia. Why is that?
It's an interesting thing. So I don't think there's any specific theory as to why they would be elevated in fibromyalgia. It's kind of a bit of a mystery. There are some certain ideas. I mean, once again, it could be that we're getting an overdrive of a response. So in various other health conditions like Alzheimer's, as you describe, there's almost a kind of underdrive of the system. The system is beginning to almost kind of shut down or not operate effectively. Whereas in fibromyalgia, it's like all of the systems are magnified in their responses. So that could be a reason as to why even those are increased. But once again, it's speculation.
Yeah, absolutely. Well, if there was a pharmaceutical drug that got results like you guys did in that randomized trial, we would be seeing a lot of commercials for that.
Right, exactly.
So yes.
Exactly. Yeah. And that's the frustrating thing about this is that if you look at 80% of the patients that go into a doctor's surgery these days, most of the time they can't really do much. They can give you anti-inflammatories, they can give you pain medication, they can give you antidepressants, but actually they're not getting to the core of it because they are software problems. That's the new modern illness.
Right.
And to get a result like this, we really want to make this mainstream. And we as the Gupta program don't even want to hold on to the IP because this is so crucial. We simply want to say, let's get the large trials, and then we're happy to train up anybody in the protocol and get this into mainstream medicine.
Yep. Really good. Really interesting stuff. Now, obviously, we've got COVID-19 going on, and a lot of people have been affected by that. And obviously, a lot of people's livelihoods have been affected. I mean, it's been, whether you've been affected and had a bad health outcome, or maybe family members had a bad health outcome, or maybe you've lost your job, or just been worried about the condition. There's a lot of trauma that's gone on with this. Not only, like we talked about, you had mentioned the flu, so obviously the virus can create trauma on us, but also just the psychological aspect of the lockdown, people losing their jobs, family members getting sick. So you created this 10-day coronavirus series. So let's talk about that.
Yes. So in April, we decided that, look, we've done a lot of research into the immune system and what's effective. So let's create a 10-day program to support people. Instead of saying it's just social isolation that's the way forward, actually boosting our own immune system is us being empowered against the virus. So this 10-day program looks at what we call the men's Gupta program. So the men's protocol is mind, exercise, nighttime routine, and diet. So the four components of our health, the four key components. So in this 10-day program, and it's completely free and not for profit. So especially with second and third waves that are happening in Europe and America, it's really important we embrace this. So the mind is all about some of the studies on meditation and how it impacts on our immune system and helps us offset viruses. And so we're looking at the existing research on other coronaviruses and flu virus, and we found that there are things you can do that can decrease your chances of infection by 50 to 60%, right, in terms of mind. In fact, meditation has been shown to be even more powerful than exercise. So then E for exercise, if you then exercise as well, imagine the impact you're having on your immune system. Yeah. Thirdly, nighttime routine. We know that actually, if you're getting bad sleep or you're getting less sleep, you can actually have a higher chance of infection by 5 or 6 times, a factor of 5 or 6, right? So getting the nighttime sleep right is great. Getting the sleep routine and getting enough sleep and the quality of sleep. And finally, D for diet. Now, diet is the default one that most people turn to when they think of their health problems, etc. But in our research, actually, the mind, the exercise, the nighttime routine are just as powerful as diet, if not more powerful. So getting our diet right and eating all the things for our microbiome, and that's obviously, your listeners will be very au fait with that kind of work that you do, is incredibly important as well. But if we combine the men's protocol with these 4 factors, I believe that it can have such a powerful impact on our ability to resist COVID-19. And actually, this was something that governments needed to do right from the start. It was an opportunity to get the population healthy, get people on vitamin D, get them exercising, make this a health, a kind of health policy challenge. And yet all that happened was all the resources got poured into obviously vaccine research, which is absolutely fine, but this area was neglected, which is why we did the research day and night over 2 weeks and published this within 2 weeks of lockdown. And we've got all the scientific references as well. So we've researched 200 to 300 research studies on what really impacts the immune system.
Well, it's really great that you've done this. And how many people are so far are going through your program? Your coronavirus
so we have about
program?
4,000. So we have about 4,000 people going through the coronavirus challenge. As I said, it's free. It's not for profit. It's just our clinic giving back. So we'd love more people to try it.
Yeah, so good. And so the Gupta program, how does somebody get started with that? So they go to your website and they go ahead and they just get signed up.
So you go to guptaprogram.com and there you can sign up for a free trial.
Okay.
So you can find lots of free videos, you can understand how it works and see whether this type of approach is right for you. And then if somebody is interested, they can then purchase the Gupta program, which is all online. So all the videos and audio exercises, everything is on there. And you also receive a manual and a floor chart in the post as well. So there's some resources you get. And we have a very supportive forum as well. So you can chat to like-minded people, support each other. And we've trained 30 to 40 coaches around the world as well to deliver the Gupta program treatment if you need that as a support. And until we get that large-scale phase 3 trial that finally and definitively proves this, we offer a 1-year money-back guarantee. So people can use it for a minimum of 6 months. If they notice no improvement, they can return it, get their money back, no questions asked, because we want people to use that money for something else that can benefit them. So people have got nothing to lose by giving the program a go and seeing the powerful effects it can have. And we found that actually it's a general health tonic. That whatever condition you're experiencing, even if it isn't a chronic illness, but it's, let's say, you generally find that you don't quite have the energy that you want, or you generally find that you've got stomach and digestive issues, that you're trying different things, but it doesn't seem to work. And, people become obsessed with this. They're like, right, oh, I didn't have my chia seeds this morning. Oh, that's why I've got stomach issues. Oh, it's because I ate that thing. And what's happening is they're increasing their layers of anxiety through these exclusion diets, because it's not getting to the root cause of what actually is the challenge. Sure, an exclusion diet and supplements can support the gut dealing with a difficult type of food or a difficult overstressed environment, but it's not going to the root cause of why is it not responding effectively in the first place. So the Gupta program can help with so many different general health conditions, and we believe it brings the brain, the body to its optimal healing state, to be able to be its own best healer. And for instance, detoxification, we know that the body itself is its own best detoxifier
Right.
when it's put in the right state to be able to achieve that, when it's in the parasympathetic state. Yeah.
Yes. Yep. And so many people are in sympathetic dominance. And you guys also have seen really good results that you've published with anxiety, with depression. Do you want to talk about any of that as well?
Yeah. So chronic anxiety, so
Yeah.
when it's become so severe it's impacting someone's life, there are similar brain pathways that are being used there. Now, once again, the brain doesn't care that that's deemed a psychological condition. As far as it's concerned, it's a protective response. Yeah.
Hmm.
And once again, pain responses, pain conditions is a similar thing. It's a protective response. So in terms of depression, depression isn't something that we formally treat with our program, because we do
Right.
believe that obviously in that category, in terms of people being taken care of, they need to be working with a doctor. But yes, we do know people who've used our program for depression and have been able to
Hmm.
gently work their way out of it. And as you've seen from the study, we had a 50% drop in depression scores after 8 weeks, which in and of itself is a
Yes.
groundbreaking result.
That's right.
Now, often in fibromyalgia, the depression is as a result of the symptomatology. So there's a linkage there, but nevertheless, what we've shown here is that this is the new frontier of medicine, that
Mm.
retraining the brain for all these chronic conditions that doctors can't treat, and people are going from practitioner to practitioner trying to understand what's going on. Let's get to the root cause of this.
Absolutely. Well, this has been a really, really fascinating interview. And those of you guys that are listening, definitely check out the Gupta program. We'll have a link in our show notes that you can go in and start that free trial. You know, especially again, if you're dealing with any of these issues like we've talked about, pain issues, fibromyalgia, possibly Lyme disease or electro hypersensitivity. You know, we have people, listeners with every kind of condition out there, you know, and if you've been dealing with something that's plateaued or you just really want to fine tune your health, this is a fantastic program to do. You know, we're entering into the new year here, and this is a great time to start a program that's going to help you think better, help you sleep better, and just overall radically improve your life and your health and retrain that brain, retrain that limbic system to take back control of your health. So definitely check it out. You got the free trial, like you said. You know, if you want to continue with the program and you don't see the results that you want, you can get your money back within a year. So you really have nothing to lose there. So check that out. And Ashok, this has been a fantastic interview. Any last words of inspiration for our audience?
Yes, a couple of things I want to share. Firstly, there are other programs out there, other approaches, and we just want to emphasize what's different about us, because when people are looking for what to do, the first thing is we go for a very compassionate approach, which recognizes that many
Mm.
people have experienced trauma in their past. So we go into helping people understand that. We're not a boot camp approach, which is do this again and again and again and
Yeah.
force your mind, because that can often create even more anxiety. And
Mm.
secondly, we're about the long-term effects. So it's about not just let's get better now, but what caused your illness in the first place? What kind of personality characteristics made you push beyond your limits? Okay, so
Right.
it's very much about the long-term benefit. We want people to stay well for the rest of their lives. And finally, just want to finish and say, whatever challenge you're facing, however difficult it feels, this is just the artificial chemical environment that the brain gets into as a result of these conditions, which lowers dopamine, lowers serotonin. You might be feeling down, depressed about your illness, but there is a way through. You can heal, you can move forward and get your life back. So many before you have done this, and you can too. So that's the inspiration I want to give to everybody.
Absolutely. Well, thank you so much, Dr. Gupta. Guys, check out his program and we'll see you in a future interview. Be blessed, everybody.